Friday, Baylor College of Medicine. Here we are in our 18th week of our COVID experience. I'm filming today from the Academic Achievement Center, and I think in the background, hopefully we have two of our students who are going to academically achieve. Otherwise, we're going to rename the center to the Non-Achievement Center. Anyway, first I want to spend some time talking about this past week's numbers. We are now up to 84,000 cases in the Houston community, and unfortunately 1,100 deaths. Now that, again, remains pretty low relative to the rest of the country, with a case fatality rate of about 3%. There's some good news here, thank goodness. If you look at our positive daily case growth trend, we've finally begun to flatten out. I mentioned that last week, but I was worried about the July 4th bump, but it looks like it's staying flat. So that's very good news. And our hospitalizations are actually beginning to dwindle down. So we have fewer patients in the hospital. We've begun to plateau in our ICU and our med surgery volume. And that's consistent with what's happening at Baylor St. Luke's as well. Harris Health, unfortunately, is really quite full. As you know, Ben Taub has a relatively small number of beds relative to its emergency room. 100,000 emergency room visits and only 250 beds makes it very easy for the Ben Taub Hospital to fill up, and that's the only one that's struggling. I was semi-amused and a little dismayed to see a New York Times article this morning that said Houston area hospitals are now sending patients to Oklahoma. So I am on a conference call every morning at 7 with my colleagues in the Texas Medical Center. We haven't sent a single patient to Oklahoma, and I'm not sure why we ever would, but we have not sent a patient to Oklahoma, so I don't know where that story is from. Not only are we not sending patients to Oklahoma, we use SetTrack, which is our emergency organization for the southern part of Texas, to distribute inpatients when and if we ever get to capacity. And we have been using SetTrack to distribute patients around to various Texas Medical Center hospitals, but not to other states. So not sure where that came from. It was quite a headline, but it's just not actually true. The other both good news and disturbing news is our positivity rate for our testing. Remember, I mentioned it peaked over 20%, and we are running right now just under 20% and about 19% of our tests that we are doing on patients being positive. And so that still remains too high. And considering we're thinking about opening up schools in the fall, you know, we're not anywhere near where we can begin to think about that. Now, obviously, the politics are beginning to fuel a lot of discussion. I think there's no question that we would love to not shut down the economy. If we used masks more effectively, we wouldn't have to. But if we don't use masks effectively and we don't do social distancing and the numbers keep up, I don't see how there's any way we can really open schools safely. But the good news is we can use social distancing and masks effectively. And there's now increasing amounts of data to support that. If you go back, I had mentioned in week 2 or 3 the importance of looking at old flu pandemics. And in flu season and in flu pandemics, masks have been shown statistically to decrease transmission in family units. There's been a number of big community studies that have not been able to show effectiveness of masks, and that's really mainly because in large meta-analyses, the studies that are negative, when they look at compliance, there's very low compliance. So unless people are actually using masks, they don't work. In the studies where people used masks effectively, there's a significant impact to decrease transmission. There was one interesting study in PLOS One also that did a mathematical study of taking the 2009 H1N1 pandemic and just assuming that masks were 20% effective and they only got 10% compliance, you could still have a significant impact. You could reduce the amount of infectivity in flu by 20%. So it shows that just even a little bit of masking helps. There have been 2 recent studies that have come out that really sort of address COVID impact. One was a study in the MMWR, the Mortality and Morbidity Weekly Report. Actually, this was sent to me by one of the members of the Health Policy and Medical Ethics Center. And what it showed was there were two hairstylists that were found to be COVID positive and symptomatic who were wearing masks. They had clients of 139 different clients who were getting their hair done, where they spent close contact for over 15 minutes. Now, both the hairstylist and the client were wearing masks. And in those 139 patients, they had absolutely no transmission. There was also a study in JAMA that just came out from the Mass General and Brigham. And what they did was look at the positive rate in their healthcare workers. And for a couple of months, they didn't have healthcare workers wearing masks, and that was the same here because of we were conserving PPE. And some of the healthcare workers started getting positive, and that rate kept going up to almost 20% positivity in their healthcare workers. And then they implemented wearing masks universally for the healthcare workers, and that plateaued right at 20%. It began to come down and slowly came down actually to about 15% of their surveillance. When they implemented patients also wearing masks, so the healthcare workers and the patients were wearing masks, there was a linear decline in positive tests down to 10%. So there's two good examples of where wearing a mask can really help. Now, I challenged Chris Amos, who's the director of the ICTR here, to do a little calculation. And basically I asked them, considering our number, remember that's the infectivity rate, which has been running over 1, so that's not under control and that's still logarithmic growth. I said, what would be the impact if everyone wore a mask? And basically, if you do the calculation, if everyone wears a mask and just reduces infectivity by 65 to 70%, within a very short period of time, weeks, the virus, you basically go to 0. So there would be no infections in the community within a very short period of time. But of course, not everyone's going to wear a mask. So what happens if just 50% of the people wear masks? Well, if just 50% of the people were to wear masks, we would be able to drive the rate down from 2,000 infections a day to under 100, almost close to 40 or 50. And at that number, contact tracing actually would be able to work on a containment strategy. So with all the political banter around, the reality is if we could just get 50 to 60% of the population to wear masks and practice social distancing, we would be able to control this, so we can no longer be having these debates about closing the economy or opening schools. So again, I'm going to appeal to everybody. The most important thing you can do is practice social distancing and wearing a mask. And remember, it's wearing a mask all the time. So we have had some clustered outbreaks with our healthcare providers. And it's not that they're getting it from patients. They're on the same team, and all of a sudden you get 3 of them infected. Well, what happened, no doubt, is somebody got infected, probably in the community. And when they're together, they're taking care of patients, they're all wearing their masks and PPE, but when they're alone in a room, having lunch, talking to each other, let your guard down, and the next thing you know, they're infecting each other. So it's really important to continue to avoid multi-household get-togethers, keep social distancing, and wearing your mask anytime you cannot socially distance. That is the most important thing. And I also thought I'd remind people, for a mask to be effective, we are assuming now that cloth masks work pretty well. And there's good data that in the community, an N95 is actually no better than a surgical mask. And cloth masks work as well as surgical masks. As long as they're pretty dense cloth, high thread counts, they're very effective at preventing droplets from getting through. Things that are closer to gauze don't work as well. So it's important to have a good cloth mask. But most of the transmission, even though there's a lot of debate about aerosolization, most of the transmission is through droplets. And masks are effective at stopping droplets. But if they do stop droplets, then the outside of the mask is going to be contaminated. And so the most important thing is when you take off your mask, do it by the ears, not by the front, And if you do touch the front, and when you do get home in the evening, wash your hands, wash your mask. It's probably a good idea to have 3 or 4 of these so you can be washing them during the day. So I do see a lot of potential for us to get out of this mess, but it's going to take each and every one of us modeling behavior, wearing masks in public, social distancing, and reminding everyone else to do the same. Of course, it wouldn't be Houston and the Baylor College of Medicine if we weren't facing a whole nother challenge. So we're expecting a tropical storm to come through on top of the usual COVID problem. But we're really good at tropical storms, so I'm pretty sure we got this one covered. We'll only know once it's gone, but everybody stay safe this weekend. Try and relax, and I hope that everybody is safe and keeps safe from the weather. Have a great weekend. I don't think the weather is going to be so accommodating, but be safe, and I look forward to seeing you next